Hey everyone, let's jump right in. Today we're going to tackle something you'll see all the time, coding for a ureteral stent removal. Sounds easy, right? Well, as you're going to see, the details are what really matter, so let's get into it.
Okay, so before we even think about codes, what exactly are we talking about here? A ureteral stent is basically a tiny, flexible tube. Its whole job is to prop open the ureter so urine can get from the kidney down to the bladder. Super common and a really important tool in urology. Simple enough, right?
So the stent's done its job, and the doctor takes it out. Now it's our turn. How do we take that action, that one specific procedure, and turn it into the right CPT code? That's the whole puzzle, isn't it? Choosing the perfect code that tells the complete story.
All right, to solve this, we've got to start with the basics. Let's look at the main procedure codes. These are your foundational pieces.
Okay, so for this procedure, there are two main CPT codes you really need to have in your toolbox. The first one is 52310.
And the second one is 52315. Now you should really think of these two as your go-to codes, the foundation for this whole scenario. But here's the thing, and this is important. On the surface, they look like they describe the exact same procedure. So let's break that down.
And here's what they both describe. A cysto-urethrostopic removal of a self-retaining indwelling ureteral stent. Whoa, that's a mouthful, right? Let's unpack it. Cysto-urethrostopic is the really important word here. All it means is that the doctor used a scope, going up through the urethra and bladder, to grab the stent and pull it out. So what's the difference between the two codes? Well, it really boils down to complexity. 52310 is for your simple, straightforward removal. 52315, that's for when things get a little tricky, maybe the stent's stuck or something. But for right now, the big takeaway is that both codes describe the same approach.
Okay, so you've got your base code. But wait, we're not always done. See, coding is all about telling the full story. And to do that, sometimes you need to add an extra detail, another layer. That's what modifiers are for. And the one we need to know here is modifier 58.
Because let's be real, a procedure doesn't just happen in a vacuum. Context is absolutely everything. The why it happened and the when it happened. Those details can be just as critical as what happened, and our codes have to show that. And that's where modifier 58 comes into play. You can think of it like adding a sticky note to your code. It's a special flag that says, hey, this stent removal didn't just happen out of the blue. It was actually planned all along, as part of the recovery from a different, earlier surgery. It's all about communicating that timing and intent. So how do you know when to tack on this modifier? It's actually a pretty simple checklist. First, you've picked your main code, right? 52310 or 52315. Got it. Second, you ask, did this happen during the post-op period of another surgery? That 90-day global window. And third, and this is the absolute key, was this removal planned from the get-go? If you can say yes, yes, and yes, then boom, you add modifier 58.
Okay, so we've got the pieces of the puzzle, the codes and the modifier. Now let's snap them together into a super simple tool you can literally use every single time. Here's your coding checklist.
Seriously, just think of this as your cheat sheet, your decision tree. You start with question 1. Was a scope used for the removal? If the answer is yes, great. You know you're starting with either 52310 or 52315. Then you move to question 2. Was this a planned return during a post-op period? If that's a yes, then you know you've got to add modifier 58. See? It walks you right to the correct answer. So simple. And really, this is what it's all about. This is the whole point. We're not just plugging in numbers. We are, and I really mean this, we're storytellers. Every single code, every modifier, it's a piece of the patient's story. And it's our job to make sure we tell that story completely and accurately.
So I'm going to leave you with a question to chew on. Today, we saw how timing and planning can totally change the code. So as you keep learning, I want you to always be asking, what else? What other little details could change the story of a procedure? Because that curiosity, that's what's going to make you a great coder. Never stop asking why.